My name is Ellen Solis, and I am the track lead of the Nurse-Midwifery Program here at the University of Washington. Midwifery is the care of people of childbearing age typically, and when we say that, we mean from the time a person starts their period all the way through menopause, so menarche to menopause. But that doesn't actually capture what midwifery is really about. We're primary care providers. We give people advice about contraception. We care for people who need an abortion. We care for people who need advice about fertility. We also provide prenatal care during the delivery of the baby, postpartum care, lactation support, and well person care. So here at the University of Washington, we train nurse midwives to go and fulfill those roles out in our communities. So there are around 50 programs that train nurse midwives in the United States. And here at the University of Washington, we are specifically a doctoral program. So that means when our graduates leave our program, they are doctors of nursing practice, and they are also nurse midwives. And that sets us apart. Most programs in our country either have a master's degree or a doctoral degree, or both. At UW, we're really focused on training future leaders and change makers, and so our doctoral program focuses specifically on helping our graduates go out there and make a difference in the world. So the Manning Price Spratland Center for Anti-Racism is the first anti-racism center at a school of nursing in the whole country. And I really think that everybody benefits from the center being here. That would be all of our students, whether it's our undergraduate bachelor's degree students, our accelerated BSN students, or our doctoral students. We all benefit from having this center here. Specifically, the center helps the faculty design our courses around anti-racism and leads to an understanding of reproductive justice and the place that nurse practitioners, including nurse midwives, fulfill in the role of taking the best care of our patients that we can. First and foremost, I'll say that they're going to experience a very rigorous academic program. It's a lot of work, but it should be a lot of work because nurse midwives and other nurse practitioners are caring for people in our communities. So when a student enters the DNP program here at UW, they take an entire year of doctoral courses at first. So they take classes on policy and the way systems interact with healthcare in our country, about research and about the foundations of nursing practice for every track that we have. And it's a whole year of that kind of really rigorous academic work. And then we move into what we call the more track-specific courses. And that means that they're learning about their own field that they have chosen, whether it's family nurse practitioner or adult gero nurse practitioner or nurse midwifery. That second year is when things really accelerate and people start getting an experience of actual clinical work in the communities. So we place our students in clinical sites, usually around Seattle. We have a lot of really great practice partners out there in the community, but not everybody actually stays in Seattle. People can go farther. We have agreements right now with practices all the way from Anacortes, which is way up north, all the way to Olympia. We are more than willing to help our students go to other places also. But what we want, most importantly, is that intimate apprenticeship model of midwifery, where our students are learning from actually doing. The other component of the program is that we require a doctoral project, which is a evidence-based practice change project that the students embark on for 2 quarters. And during those quarters, they work really closely with our community partners to design a change-making project. So when I say it is academically rigorous, I mean it, but the students have so much support from their faculty and other midwives out in the community that it really helps them grow into being the best midwives that they can be. I would really encourage them to know what the role is, to know what nurse midwives do, to understand that we provide a lot of care for people who are having babies, but we also provide a lot of care for people that have other needs. For instance, birth control, for instance, abortion care, for instance, just well person care. Because I think we think about a midwife, we think about the joy of bringing new life into this world. We're so excited because there's a baby, but our role is so much more expansive than that. And I think everybody should understand that is the role of a nurse midwife. I would also give anybody entering the field the advice of have a little bit of experience. You don't have to work as a labor and delivery nurse or a postpartum nurse, but if you understand what a clinic looks like, or a labor and delivery looks like, or a birth center or home birth, anything like that, it can help you understand this giant field that you're entering and help you understand that this is really meant for you.